So hi everyone. So I am Dr. VC Sridharan, Assistant Professor from SNS College of Physiotherapy. So in this video, we're going to see about the topic which is known as bleeding diathesis. So these topics generally presents in the for the PPT students in the general medicine, general surgery topics. So in the what is bleeding diathesis? So the bleeding diathesis is generally refers to an unusual susceptibility. So what is an susceptibility? Which is due to mainly the deficits in the blood vessels and as well as also reduction in the platelet count, and finally it is also a disturbance in the coagulation system. So what is the pathology for the bleeding diathesis? So the bleeding diathesis is mainly due to an impairment in the hemostasis mechanisms. So in the hemostasis mechanisms, it generally comprises of the vascular integrity disruption, or as well as also the platelet function reduced level, or as also the number of abnormalities which is due to an disruption in the platelet formations. And it is also comprises of the coagulation factor deficiencies, and finally it leads to the prolonged bleeding or the spontaneous bleeding. So what are the types of the bleeding diathesis? So generally the bleeding diathesis is generally comprises of the three types. So the first one, it is known as the platelet disorders, then second one it is called as the coagulation disorders, and third one it is called as the vascular disorders. So first, platelet disorders is mainly comprises of the conditions such as, for example, thrombocytopenia. So due to thrombocytopenia, the platelets levels will be reduced in these factors. In the coagulation disorders, it mainly comprises of the hemophilia. So generally the hemophilia is of the two types, hemophilia A and the hemophilia B. And it also comprises of the condition which is known as the von Willebrand disease. Then third one is vascular disorders. So these vascular disorders is generally comprises of the conditions such as scurvy. Then it is also called as the Ehlers-Danlos syndrome. So these are the conditions which is comprises of the types that involved in the bleeding diathesis. So general causes for the bleeding diathesis are, so first one is congenital causes. So these congenital causes comprises of the hemophilia A and B. Then second condition is known as the von Willebrand disease. So then second causes is which is known as the acquired causes. So these acquired causes such as the liver diseases, vitamin K, and as well as also side effects of the some of medications such as anticoagulants and DAC. So these are the factors that causes in the acquired cases. So clinical features. So clinical features for the bleeding diathesis are, first one is easy bruising. So bruising means superficial impact over the skin, which is known as the bruising. Then second one is purpura. So purpura is the purplish discoloration over the skin surface. Then third one is prolonged bleeding after injury or in surgery. Then next one is hemoarthrosis. So hemoarthrosis is the blood coagulation in the joint surfaces. Then third one, next one is mucal bleeding. So generally the mucus comprises of the bleeding, and as well as also the gums, which is also comprises of the bleeding. And finally menorrhea. See, menorrhea is which is known as the abnormal menstrual cycle in the female. It is known as the menorrhea. So investigation method and the diagnostic method for the bleeding diathesis is, so first one is CBC. So CBC is nothing but the complete blood count, which in that condition, in that cases, we can count the platelet level in the blood. Then second one is bleeding time, then clotting time. By factoring that comprises the bleeding and the clotting time, we can assume that we can finalize that the patient is whether affected by the bleeding diathesis or not. Then next one is thrombin time, and next one is platelet functional tests, and finally the factor assays, which and it also comprises of the von Willebrand conditions. So due to that we have to measure the von Willebrand factor levels also. So medical management. So medical management for the bleeding diathesis are, so first one is the replacement therapy. So while replacing the factor 8 and the factor 9 concentrates, we can control the bleeding diathesis. Then next one, that is a drug which is usually going to prescribe for the bleeding diathesis is desmopressin. So desmopressin is widely used for the patients who have been affected by the hemophilia. Then after that, we can also prescribe them the antifibrinolytics, and we also prescribing for the vitamin K deficiency drugs, and finally steroids for the immune deficiencies. In rare cases, if finally it can lead to the surgical management. So surgical management, we are going to do some of the surgical factors such as the reserved for treating complications, which is known as the hematoma evacuation. The next one is preoperative factors replacement before any procedure, and finally the cauterization and also the ligation in the cases of the uncontrolled bleeding. So these is the factors that involve in the bleeding diathesis. So see you on the next video. Thank you.